do my thing. Watch me do my thing.
Hi, welcome to the chat with your rising doctor, D.R.Lee.
Watch me do my thing. Watch me do my thing.
Today is all about anxiety disorders. I feel personally connected when I talk about anxiety. It affects over 40 million people in the United States. That's 18% of our population. But only 36% of people actually get treatment for it, according to the ADAA. Now, anxiety disorders include diagnoses such as separation anxiety, selective mutism, specific phobia, social anxiety disorder, a common one that we all may be familiar with, panic disorder, agoraphobia, and one that we're going to talk about in specific today called generalized anxiety disorder, also known as GAD. Now, evolutionary psychology tells us that anxiousness is a natural survival mechanism. Our ancestors, our forefathers dealt with this. They used this instinct and this mechanism to hunt for food, to build for shelter. And even though we're not having to do those things today, we are still bombarded with a number of anxiety-provoking triggers in our environment, in our cultures, and just our lifestyles. Stress is embedded in almost every fabric of our lives. GAD, generalized anxiety disorder, is coded as 300.02 in the DSM-5. And people diagnosed with this disorder feel extreme worry, a chronic worry that lasts potentially every day for at least 6 months. They can feel mind blanks, poor concentration, sweating, muscle tension, sleep disturbances, all of these things. I feel connected when I talk about anxiety because in my own community, in the Black American community, there's a higher percentage of anxiety seen and a potential for anxiety manifesting in different ways, which is why research in specific populations is so necessary for us to understand the totality of things. Now, when we talk about the DSM-5, the criteria for diagnosing anxiety disorder, specifically generalized anxiety disorder, we are talking about A through F for the diagnostic criteria, which is excessive anxiety and worry occurring more days than not, and for at least 6 months. Difficulty controlling worry, anxiety and worry associated with at least 3 of these symptoms, such as restlessness, fatigue, mind going blank, poor concentration, irritability, muscle tension, and sleep disturbances. The symptoms are causing distress and impairment in one's life. This anxiety is not attributed to any substance abuse or any medication component. And there is nothing else that better explains the symptoms. Diagnostic criteria must be met in order to diagnose for generalized anxiety disorder. There are many assessment tools that are used to diagnose GAD. Some of the popular ones administered by doctors are the GAD-7, which is a set of 13 questions, the HADS, Hospital Anxiety and Depression Scale, used to assess depression and anxiety, and the State Trait Anxiety Inventory, STAI. It's a 4-point questionnaire used in clinical setting to diagnose anxiety and to distinguish it from depressive symptoms. The HAM-A was one of the first rating scales developed to measure the severity of anxiety. The scale consists of 14 items, each defined by a series of symptoms and measures both psychological distress and somatic symptoms. We do have some highly treatment interventions for GAD, generalized anxiety disorder. You may receive a combination of counseling and medication for management. Anxiety disorders can be treated mostly outpatient. But if there is an indication of suicidal ideation or unresponsiveness to standard treatments or relevant comorbidity with major depression or personality disorders or substance abuse, then there may be need for hospitalization. The use of CBT, which is cognitive behavior therapy, is most widely used for anxiety disorder treatment, and it's highly effective. CBT addresses the negative patterns and distortions in the way that we look at the world and ourselves, helping us address our perspectives on things. And then the medication component includes antidepressants, selective serotonin reuptake inhibitors, the SNRIs, the SCAs, and can be used as the medication component. These are medications like Lexapro and Cymbalta and Effexor that we have found to be highly effective in the management of generalized anxiety disorder. GAD is one of the most frequent of all psychiatric disorders seen in primary care, second only to depression. Women are twice as likely to have this disorder, and as I mentioned before, it can be seen slightly more in some populations. When we talk about GAD, even though we have a highly effective treatment, it's important to seek treatment. GAD therefore incurs a substantial burden not only on patients and their families, but also on the healthcare resources. We must continue to educate people about generalized anxiety disorder and the interventions that we have to treat them. This is in the chat about GAD with your rising doctor, D.R.Lee.
You're not good enough. When people say you never make it. When people say you're not good